Dealing with a patient here who has a disc degenerative change rather than us treating the disc degeneration. Haven't we moved on past that, or is that still an issue?
It's still an issue. So this is what we call, largely sort of treating the numbers, not the patient, or treating the X-ray, not the patient. I mean, I see it in orthopedics all the time. It's difficult to get away from this concept. If you look at a fracture and you see that the bones aren't perfectly lined up, and the tendency is to put them back where they were. But that's not always necessary. You've got a fracture that's going to heal fine with normal function. Why are we doing surgery on it? And yet we tend to treat the X-ray, not the patient, and treating the numbers, not the patient. And there's a great term that was coined by some US doctors in an article they wrote, we refer to in the book, and they use this term, the normalization heuristic. Which means this rule of thumb that we have where we just want the numbers to be normal. And it's a very powerful thing. And there's been some great studies done. One we quote is in intensive care, was this argument looking at tight glycemic controls. So looking at people's blood sugar and trying to keep it within a very narrow range of normal, because obviously if somebody's blood sugar is too high, that's bad. If their blood sugar is too low, that's bad. And so they would have this really tight control and try and keep that blood sugar exactly right. So if it got a little bit high, you give them some insulin. If it dropped a little bit, you give them some sugar, and you just get it just right. And this was a philosophy for a while until they tested it against maybe just sort of leaving it alone and just letting it go a little bit. And they found that tight glycemic control was associated with more harm than not doing it. And it's a classic example of treating the numbers, just trying to get this number right instead of asking yourself whether that actually helps the person. And another classic example was the use of flecainide, which is an anti-arrhythmic drug, which in the 80s was used to try.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.